My name is Regina Pruitt. I'm from Hoover, Alabama, and I have a pre-existing condition. I was actually diagnosed with cystic fibrosis at a very, very young age. I was born with a condition called meconium ileus. Basically, it's a blockage in the small bowel, and the only known cause for that is cystic fibrosis. I have breathing treatments in the morning, I have breathing treatments in the afternoon, and depending on really kind of day to day my respiratory health, sometimes I have to do 4 breathing treatments in a day. Not to mention all the pills that I have to take, roughly 50 to 60 pills total a day. I'm currently on the lung transplant list at UAB. I was listed November 15th of 2016, so coming up on 2 years that I've been listed. About every 6 to 8 weeks I have to go in the hospital for IV antibiotics for pulmonary exacerbations. I'm 43 years old and I'm on a double lung transplant list, and I mean my life expectancy is maybe 2 years, maybe. Well, I can remember a time in my life when I had no insurance, and that was very difficult. And the reason I didn't have any insurance is because I wasn't accepted by any of the companies because I had a pre-existing condition. And that was tough. Financially, that was tough. It's just a big financial burden. And then like now, there are medications that insurance might cover a certain percentage of, but if you've got a drug that's $17,000 a month and your insurance pays 40%, that still leaves a huge chunk of change. So right now I have a grant from the Healthwell Foundation that is covering most of that copay. But when that runs out, I guess I just will stop taking that drug. You guys probably wouldn't think that 3 weeks ago I was in the hospital getting IV antibiotics. You wouldn't think I have a port, which I do. I have a feeding tube. You wouldn't know these things just looking at me. So one thing that I would like people to know is just because someone doesn't look sick doesn't mean that they don't have a chronic illness. The overall opinion from people that don't have any health problems or don't have any family members with health problems would be a little bit different if they spent a day in the life of someone with a pre-existing illness.